Thank you, Madam Speaker, distinguished past presidents, Board of Trustees, delegates, and members. I'm happy to bring you some good news this evening. A significant victory for the American Association of Medical Assistants in regard to the right to practice arena. An overview is that the Centers for Medicare and Medicaid Services, also known as CMS, in its rulemaking process, the first stage 1 rulemaking stated that only licensed healthcare professionals would be able to enter medication orders into the computerized provider order entry system. Thanks to the efforts of the AAMA submitting written comments and a letter, in stage 2 of the CMS regulations, the language was changed so that specifically credentialed medical assistants are also able to enter medication orders and other orders into the electronic health record. I'd like us to, tonight and going forward, celebrate this victory and also disseminate the information as widely as possible. We have information on our website, on my legal blog, and there will be articles published in CMA today. This is our opportunity to really show our members and indeed the whole world what the AAMA is able to do for the medical assisting profession and for certified medical assistants, AAMA. We'll have an opportunity for questions at the end of this talk, and I am going to just go through some basics in regard to the victory that we have won. First question, what is the Medicare and Medicaid Electronic Health Record Incentive Program? Basically, Congress decided that it was necessary for the American health system to utilize to a greater extent electronic health records, EHR, sometimes known as electronic medical records. To do this, Congress decided that there needed to be financial incentives for providers in order to achieve meaningful use, another important phrase. In other words, in order for a provider to get these incentives, the provider would have to show that a certain amount of the medical records were entered in electronic format. Now actually these are two programs. The Medicare and Medicaid program are two distinct programs even though they're very similar. It's important to keep in mind that a provider can only participate in one of those two, not in both the Medicare and the Medicaid program. I'm not an expert in this area. The rule was 672 pages. I did read it all, some of it skimming, but basically I, of course, am focusing on the areas that are pertinent to the medical assisting profession. Now, what is the role of the CMS in all of this? Congress passed the statute and then delegated to CMS the authority to issue rules and regulations to spell out the specifics of the program. And CMS has done that, and that's where we got involved because the stage 1 regulations were not good for the medical assisting profession. Now let's talk a little bit about what the CPOE means. This stands for Computerized Provider Order Entry System. CPOE, again, Computerized Provider Order Entry System. Who is eligible to receive these financial incentives authorized by Congress? Basically, there are three categories. Category number 1, eligible professionals, also known as EPs. Category number 2, critical access hospitals. And category number 3, eligible hospitals. Our interest is mostly in regard to the eligible providers. And I'd like to share with you who is considered an eligible provider because they're different between the Medicare and the Medicaid system. So under the Medicare EHR incentive program, the following are EPs, or eligible professionals. First of all, doctors of medicine or osteopathy. Secondly, dentists. Thirdly, podiatrists. Fourthly, optometrists. And finally, chiropractors. Let me repeat those again. Under the Medicare incentive program, these are individuals who fall into the eligible professional category. MDs and DOs, physicians and osteopaths, dentists, podiatrists, optometrists, and finally, chiropractors. Under the Medicaid system, there are broader definitions. The people who are eligible to receive incentive payments under that system are again physicians and osteopaths, but also, and note this, nurse practitioners, only under the Medicaid program, not under the Medicare program. Certified nurse midwives, dentists, and physician assistants who furnish services in a federally qualified health center of rural health clinics. So again, we have physicians and osteopaths, nurse practitioners, certified nurse midwives, dentists, and physician assistants, only those who work in federally qualified health centers. Now the issue is who can enter medication orders into the CPOE. Stage 1 said that only licensed allied health professionals can do so. The AAMA wrote a letter to the officials at the Department of Health and Human Services indicating that this was not correct public policy because medical assistants who are properly educated and credentialed are also able to competently and safely enter medication orders into the record. A few months later, CMS issued Stage 2 proposed rules, which said that they would like comments as to whether their category for licensed allied health professionals should be expanded or whether it should stay the way it was proposed in stage number 1. At that point, the AAMA submitted written comments strongly urging CMS to broaden the category, not to the extent that anyone could enter medication orders, but only credentialed allied health professionals, especially certified medical assistants, AAMA. The final rule in Stage 2 was issued on August 23rd, and the official version was published on September 4th, just a few days ago, in the Federal Register. Some have thought and have contacted me that this is just a preliminary proposal. It is not. CMS has clearly decided that credentialed medical assistants are permitted to enter records into the CPOE. Now, one thing I want to mention at this point is that credentialed medical assistants, in my opinion, having read the regulations, does not mean those who have an academic credential, who have an associate degree or a certificate or a diploma in medical assisting. Rather, I interpret the rule to mean that there must be a standardized national credential given by a third-party certifying body, such as the certifying board of the AAMA. So in case you get questions, it's not enough for a medical assistant to just have graduated from a program. That individual must also have a credential. Now, another interesting point is that in the Stage 2 rules, the authority to enter orders was broadened beyond the medication orders. CMS said that credentialed medical assistants could also enter laboratory orders and radiology orders, as well as the medication orders. So that is really significant because I was getting emails and calls from CMA's AAMA wondering whether it would cover these other orders. It's very clearly stated in the regulations that credentialed medical assistants may enter medication orders, laboratory orders, and radiology orders under the authority of an eligible professional, of course. Another point I want to alert you to is the fact that this final rule that was issued on August 23rd has some errors in it, and this is very typical for regulations of a federal agency. In fact, under Stage 1, there had to be a 30-page follow-up technical correction rule to correct all of the errors or the omissions in Stage 1. So if someone says to you, well, I looked at this page of the CMS regulation and it still lists licensed healthcare professionals, you can tell them that that is an error that will be corrected in the technical correction stage.